Webster Technique was developed by Dr. Larry Webster over 30 years ago as a way to improve birth outcomes in women. The technique involves an analysis of the position of the sacrum, adjustment of the sacrum, and release of the related soft tissue around the sacrum and womb. Dr. Sarah uses this technique as a total release of the hips in all populations of people, both pregnant and not pregnant, because it is so effective in restoring the neurobiomechanics of the pelvis. By correcting the neurological potential of the pelvis through the adjustment, a myriad of health improvements can occur. Since the adjustment focuses on stimulating those nerves that exit through the sacrum, some of the health effects include improved fertility outcomes, improved nerve function to the baby, and muscle tone of the womb, releasing the muscles around the womb so baby can have room to position themselves appropriately for birth, improve birth outcomes, including decreased labor time, not to mention improved gut functioning and decreased low back pain. Our goals in our clinic are always designed to bring balance back to the body so you leave here functioning optimally to live your best life.